We're now on the Premier's questions, and again for process, it works by members submitting a list of members who would like to ask questions, and I've received the list this morning, and I'll go by the list that's been presented to me. Premier, the first question to you this morning is from the opposition leader. Honourable member.
Thank you, and good morning, Mr. Speaker.
Good morning.
And to Bermuda. My first question to our Premier is considering the press conference that was given yesterday and the note taken that shipping was not an issue. I was wondering if the Premier could explain to us exactly what he meant by shipping, and I'm asking that question because although ships may be able to come here, there doesn't seem to be any mention talking about plan for food security. So ships may come, but they may not have staple items. So if he could clarify that for us, I'd appreciate it.
Thank you. Mr. Premier.
Good morning, Mr. Speaker. Mr. Speaker, as part of regular planning, it is made sure that we do have food security. These are not things that we just started checking on last or this week. It is stuff that since the beginning of the World Health Organization's issuance of a public health emergency of urgent concern, we have begun particular preparations. I'm happy to share, because I have information from the Neptune Group Management, who's the manager for Bermuda Container Line, items which were sent to my office and said, this is to confirm the Bermuda Container Line has taken appropriate planning and prevention action to make sure the weekly New York to Bermuda shipping service is maintained. This includes proactive initiatives and contingency planning to minimize the risk of introducing the COVID-19 virus to crew and staff. Meanwhile, goods from New York continue to flow as normal. Import volumes are slightly up over the last year as importers appear to be stocking and restocking certain items. The Oleander vessel and our U.S. and Bermuda offices have their prevention and contingency plans that have been initiated. That is the basis, Mr. Speaker, on which I made the announcement that at this point in time there is no planned and or expected disruption to our particular shipping and regarding our food supplies on island.
Thank you. Let me just, our clock and timing system is new. I don't know if we can do the breakup of your 3 minutes and the 30 minutes. So the 30 minutes that's allowed for the Premier for the Premier's question started at 10:38, which means it'll end at 11:08. And I'm going to prefer to just keep the clock on the 3-minute timer, if you don't mind. Second question or supplementary?
Yes, supplementary. I was wondering also if, in addition to, we're talking about the supply of food security, taking into consideration the potential of this particular virus and the medication that we currently stock on the island, is that also being considered as we look at the potential of having this virus here and being able to accommodate through the medications that are being used for this?
Thank you. Premier?
Mr. Speaker, the answer to the honorable member's question is yes, it is being taken into consideration.
Thank you. Supplementary or new question? Supplementary?
Yes,
Second sub?
Supplementary.
Yes.
We understand. I guess the question is, no, I'll wait for that. Sorry, I'll use this other one here. We understand that customs officers are not happy with some of the preventative measures that are being taken place down at the airport. And I guess what I'm asking the question, and that there is some timidity around asking the questions and taking on travelers. Is this to be the case? Is the Premier aware of this?
Premier?
Is this a new question or a supplementary question?
Supplementary.
Supplementary to the shipping? I'm confused.
Hold on.
This is all about exactly. This is all about goods coming in and out, people coming in and out. So, okay. Yes, I did, and then I further went on to talk about.
Just
and then I further went on to talk about the second supplementary question was about the drugs. coming in, whether or not we've handled that particular situation. Now I'm asking the question also, I mean, you can I asked about shipping, what did he meant by shipping? He didn't qualify that. Shipping could be a number of things, also bringing people here as well. So I asked a supplementary question about customs and people. I mean,
The question was,
me to put,
so the question is, are the personnel who are involved in the shipping happy with the process
it
that
involves customs.
No, I'm just trying to clarify the question. So the question is involving the personnel on the shipping end. Are they comfortable with the process?
Yeah, no. Well, and I'll clarify the question then, since you're helping out. We are under, different supplementary. Considering the answers concerning the shipping, has the Premier spoken and had other discussions with the unions concerning the shipment of goods coming in, the handling of goods coming in, and in addition to that, the handling of people coming in and out of the island?
Premier?
Mr. Speaker, I have not had those discussions personally. We do have a quarterly meeting with the unions. There were some concerns which were raised. I am satisfied that the Minister of National Security and also the Minister of Health, with the conversations of which were had with the stevedores on the docks regarding questions and procedures, have satisfied those particular issues.
Thank you. Second question? Yes?
Second question. We have information that well, we know that many countries have banned those traveling from Italy and Spain from coming into their shores. We are aware that through customs coming to Bermuda, through the airport, that folk are coming from Spain and Italy via London and then coming through customs to Bermuda unchecked. Are we looking to prevent that from happening, since they have been banned coming into other countries, considering the prevalence of the virus?
Premier?
Thank you, Mr. Speaker. Mr. Speaker, it is not correct that the opposition leader will say that they are coming through unchecked. All travelers are asked a questionnaire upon their particular arrival. What I can state, Mr. Speaker, is that the Minister of Health has added Italy to the list, and also the Minister of Health has informed me that based on the recent advice that has been given, there will be amendments to the listed country for exclusions for entry into Bermuda of persons traveled from France, Spain, and Germany, in addition to Italy. What I can say, Mr. Speaker, is that it was an incident last evening where there was a plane which had come from from Switzerland through Italy. That plane itself had persons who had traveled from Milan. That those persons were denied landing in Bermuda. The plane they were not allowed to get off the plane. The plane landed, it was refueled, and then it went further. They wanted to stop in Bermuda, and we did not allow them to stop overnight.
Supplementary?
Yes, supplementary. I guess what I would like is, I certainly was not talking about that particular incident. I was talking about a prior incident. We know that nationals have come from Italy and Spain to Bermuda. I would like for the health minister, the immigration minister, to check into this, because it is happening for a fact. We know this. So please, if we're including, if they can let us know when they decided the ban on Italy, when did they decide the ban on Spain and France, if we can get that answer.
Premier?
The advice and the matter was published last night prior to this plane being landed regarding Italy. The Minister of Health informed me this morning that the additional countries which has come on the list are France, Germany, and Spain. What is important for the Leader of the Opposition to note is that the Ministry of Health is working off of advice that they are receiving. That advice is coming in. The situation is changing very quickly, and we're updating as quickly as the advice comes in, Mr. Speaker.
Thank you. Supplementary? Or second supplementary?
Years old, man. Didn't I use?
Yeah, you asked one supplementary.
Okay, that's
this
good.
is your second supplementary or new question.
No, that's good. That's good.
Second supplementary.
He didn't answer the question, but Let me just preface this next question by saying that I did meet, and I thank the Premier. We met this morning, just discussed some of these matters. So I was very appreciative of this here, and I did let him know of some of my concerns. And so when I ask these questions, I'm not asking them because I'm trying to trip him up. We met this morning. It's important that we get as much information out as possible. And so when I ask the question that I know that these nationals have come from Italy and Spain to Bermuda, I'm asking them to check into it because it has happened. It has happened. So I know they're juggling around right now, but it has happened. So my third question is this. The Premier also mentioned that contingency plans have been put in place concerning civil service. I was wondering if the Premier could explain exactly what he means by contingency plans to protect civil service. If you can explain that.
Premier?
Thank you very much, Mr. Speaker. As I had indicated in my answer to the first question, when the World Health Organization declared that this was a public health emergency of international concern, planning started from our perspective inside of the government. That means that, as I had mentioned in my press statement yesterday, the persons from the Emergency Measures Organization were embodied inside of the Ministry of Health. So the public health, with the Public Health Emergency Response Team, there were additional resources that were brought on to begin the preparations for what was an escalating situation at that particular point in time. When that particular matter happened 2 weeks ago, I directed the Department of Information and Technologies to go ahead and prepare to have the ability for all government workers who work on a computer to be able to work remotely. I can confirm that that particular capability was secured and confirmed last week Friday, hence the announcement which was made, and I can confirm that there are tests that are going on today for that remote capability. So that remote capability does exist. We have licenses for all workers who work remotely. We have licenses for all workers who use computers to be able to work remotely, and the testing of those particular issues are happening today.
Thank you. Third question now.
Yeah, I'm supplementary now.
No, you asked two supplementaries on your second question. This will be your third question now.
No, I went to my third question.
Third question. Yes.
Okay. Considering the civil service, I was curious as to whether or not when can we expect that members of the civil service actually will work remotely, understanding that as having been government before, we know that there are those right now who could work remotely to help with the situation. And considering this pandemic, is he expecting to have cabinet meet on a more regular basis, being that this pandemic continues to present challenges for all?
Thank you. Premier?
I thank the honorable member for his question. As I said, we act on the basis of advice that is received and following, as I said, inside of my discussion yesterday, the science. I can state that if there are cases of COVID that are detected here in Bermuda, we know that there are all the cases which have been sent off for testing have come back negative. There are suspected cases and persons that are not suspected cases, but there are persons who have been tested and are monitoring. If at the points in time, as in the Public Health Emergency Response Team yesterday, there are cases detected, we will begin to implement measures to contain community spread.
Thank you. Last one.
Yes. Considering that answer that was giving, Mr. Speaker, just curious as to whether or not recommendations have come. Can he give us an update on recommendations that potentially will be implemented that came from the Medical Council?
Premier?
Mr. Speaker, the Minister of Health advises me that there have not been any recommendations from the Medical Council.
Thank you. That brings Opposition Leader. You've used all of your questions up this morning. The next member who has on the list is the Deputy Speaker. Deputy Speaker, would you like to put your question?
Thank you, Mr. Speaker. Mr. Speaker, Mr. Premier, What is the process for children that are sent overseas by the Department of Child and Family Services?
Premier?
Mr. Speaker, I thank the honorable member for his particular question, because there are a lot of difficulties with this, and although members across the aisle are stating that these questions were answered in the budget debate, I think it's important during this time to make sure that those particular things are addressed. It is important that we understand the steps that are involved before a child is considered an applicant for overseas placement. The Department of Child and Family Services does not work in isolation when assisting children and families with their challenges. However, when all else fails, DCFS has a responsibility of developing and providing a solution as legal guardian of children that are placed in care. Often, the first issues are identified when a child is in the school system. This is often manifested in behavioral problems that impact the learning environment for that child and others. These behaviors often cause trauma to the system, and DCFS is frequently contacted by the Ministry of Education of the results of disruptive children. DCFS conducts an assessment to determine what services are required and partners with collaboration with community partners, including counselors, psychologists, psychiatrists, and agencies with the Ministry of Education, Child and Adolescent Services, Family Center, the Coalition of Protection of Children, Center of Abuse, etc. When considering overseas placement, all the assessment and treatment reports pertaining to the child are fully reviewed by the Psychoeducational Committee. The committee is comprised of senior representatives from the Ministry of Education, Child and Adolescent Services, and the Department of Child and Family Services. The committee reviews and approves applications for overseas assessments and treatment. Where there are several priority issues that appear to be causing challenge for the child and family, an application is made for an overseas comprehensive assessment using a comprehensive assessment team model. Once organizations have been identified, referrals are made, and if it is an overseas program that has not been previously used by the department or it has not been used for more than 3 years, the program is vetted by senior staff within the department. Vetting ensures that the program operates at best practice standard with regards to its service provisions. The department's current policy dictates that all overseas programs must be licensed and accredited. Must be noted, Mr. Speaker, that any child involved in the psycho-ed program must be in care of the director. This is to protect the investment of the government and provides for family court oversight and accountability. All children in care of the director must have the permission of the court to travel, and DCFS must provide information as outlined in the Children Act before the court will prepare the required order. Thank you.
Thank you. Supplementary? No supplementary, Deputy? The next person on the order this morning, on the list this morning, is the Deputy Opposition Leader. Honorable Member, you can put your question.
Thank you, Mr. Speaker. Good morning. Mr. Speaker, my question for the Premier is, I understand that there are currently 30 beds allocated for any coronavirus issues. Is there an overflow plan if we exceed 30 beds? And if so, what is it? And is there an overflow location?
Premier?
Thank you for that question. Mr. Speaker, I'm going to answer to the best of my ability from my recollection at the Public Health Emergency Response Team meeting yesterday. What I can state is that the Bermuda Hospitals Board is making the adequate preparations of which are necessary. The Bermuda Hospitals Board has ordered additional medical equipment, recognizing that the virus itself, SARS-CoV-2, or commonly, which causes these COVID-19, is recognized to have severe respiratory issues as well. I do note that additional ventilators have been ordered to make sure that those facilities are going to be available at the hospital. Regarding overflow plan and overflow capacity, the Bermuda Hospitals Board has previously invested in, so we do have the ability to set up field hospitals if necessary and the equipment which are required for those particular issues should we get to that point. However, Mr. Speaker, what I must state is that, as I issued very clearly inside of the Public Health Emergency Response Team, conversation, discussion with business leaders, etc., Our complete and absolute desire as a governor of Bermuda is to minimize, or as they say, to flatten the curve. So there is additional advice which is coming to us at this point in time regarding additional measures which may be taken. You would recognize earlier this morning, Mr. Speaker, that the Minister of Labor, Community Affairs, and Sports had a press conference and where it was decided that the CRIFTA Games would be postponed. We are currently making a determination whether or not there is going to be any additional advice for any additional meetings and public gatherings which may be taking place here this weekend to be postponed. I've asked the Minister of Labor, Community Affairs, and Sports to inform our department that the events which are taking place this weekend, including the Premier's concert and also the sports awards which are supposed to take place tomorrow evening, may have to be considered to be postponed as well. I'm awaiting additional advice from the Ministry of Health. I must say, Mr. Speaker, in this answer, I have to do my job to commend the Minister of Health and the Ministry of Health, who have been working around the clock in making sure that we can be prepared and are doing this. They have multiple bits of information that are coming in at once, and they are trying to make sure that all these things have been collated. There is an entire team of persons that are working, and I was very impressed with that presentation which took place yesterday, and I'm sure that members, when they get the presentation today at lunch, will also have a better understanding and recognition of all the steps which are being taken. Our job is to limit community transmission, and we're doing as much as possible in order to ensure that happens. But what I can ensure the Deputy Opposition Leader regarding the particular question in which she asked, that all matters are under consideration.
Thank you. Supplementary?
Yes, please. Thank you. Thank you, Premier, for your answer. My supplementary is, in the event that the hospital does become overwhelmed, have we considered bringing in nurses and doctors? And if we do have to bring in other people, will work permit fees and things like that be waived in order to get them here quickly?
Premier?
I cannot state whether or not workers and doctors have been considered to be brought in. I do know that there are additional nurses which have been recruited inside the community, retired nurses, et cetera, who have been in health that are being brought on board to make sure that we have the capacity. This is not recent. These things were announced previously, and those things went into action when the World Health Organization declared this a public health emergency of international concern prior to the declaration that it was a pandemic. So these processes and plans have been going on since then. If I may, Mr. Speaker, at this present point in time, take the opportunity, as the Minister of Health has just provided me with something. The Medical Council, the Bermuda Medical Council, did meet yesterday. COVID-19 was the only agenda item, and recommendations were made to physicians and sent in an email regarding community care. These recommendations are similar to the recommendations which have already been issued for the Ministry of Health.
Thank you. Second supplementary?
New question, please.
You only got one question.
Sorry.
You have two supplementaries with one question.
I don't have any more then.
Okay? Two.
Okay. No.
Two. Yep. That means they'll now move on to the next member who has a name on the list, and that's MP Terrell. MP Terrell, would you like to put your question?
Good morning, Mr. Speaker. My question basically was similar to the first question asked by the opposition leader. But if the Premier wishes to elaborate, I just wanted to get assurances that goods and items will continue to be shipped to Bermuda during this coronavirus issue. Thank you, Mr. Speaker.
I appreciate the question from the honourable member. The information of which we have right now is that shipping lanes will continue to be maintained. This is a rapidly evolving situation. I have no indication whatsoever that that will particularly change, Mr. Speaker, at this point in time. As stated, we can only rely on the information that has come in. It is not something that we just started doing yesterday. This is actions of which we have been taken for the last 2 weeks. And therefore, what I want to say, and this is something that is particularly important to note, is that we have this particular item. We are continually checking and making sure that we are getting the information that's updated. And I'm trying my best to prepare and to present the latest information to members not only of this honorable House, but also members of the public. But at this point in time, we are confident that our supplies will continue, and as has been indicated in my answer before, why?
Yeah.
Are you
Talk this way.
You can't talk and listen at the same time, though.
Speak to the chair. You'll be fine. Just speak to the chair. Don't get sidetracked.
just trying to be able to focus, Mr. Speaker.
I'm
got you.
I'm listening. My ears are always there. You need to
I'm
be
having
speaking to
trouble
you.
keeping my thought with all the chatter coming in the ears, Mr. Speaker. Thank you. What I will say, Mr. Speaker, is that matter will be continued to be monitored. What members will note is that the government has launched a new website, coronavirus.gov.pm, which has all of the particular information in it. We are putting out daily updates on that. I know that there are members of the community that are concerned regarding supplies and what's called. There is no particular need at this point in time. We are relatively certain that our supply chains will continue. And as has been indicated in my answer earlier, additional supplies have been ordered, not only for food and other items, but things that are needed inside the community.
Thank you. Mr. Terrell, do you have a supplementary or
Mr. Speaker, no, thank you.
no? The next member on the list is that of the Honorable Member Gordon Panthelin. You have the floor.
Thank you, Mr. Speaker. Mr. Speaker, we're going to change tack a little bit here from the challenge that we're dealing with as a country. But my question to the Premier is, given the changes to the standing orders that have been ratified today, will the Premier advise us what the purpose is of asking new questions when legitimately posed questions from July 26, 2019 remain unanswered?
That may be outside of the Premier's domain as far as some delay. Let's put it that way.
Okay.
Okay?
Okay.
All right.
Okay.
Okay.
In which case, I have a different question then, if that is the case. I wonder if the Premier could advise whether, given the extenuating circumstances surrounding the stresses that we are experiencing, that we will experience with respect to the budgeting process, whether they would be prepared to support bringing a mini budget in 3 months' time or thereabouts when we have a better indication as to what the financial impact will be on this worldwide challenge with which we are dealing.
Premier?
I thank the Honorable Shadow Minister of Finance for her question. What I can say, Mr. Speaker, is that I know that the Minister of Finance has had a meeting with the Shadow Minister of Finance to discuss the various options that are on the table from the government's perspective. I can state also that there was a meeting by the Minister of Finance with the Bermuda Bankers Association and also business leaders and union leaders yesterday, attended by myself, the Minister of Finance, the Minister of Tourism and Transport, and also the Deputy Leader. What I will state is, Mr. Speaker, is that at the time that we come back from our recess, there may be the need to update that, and I'm sure the Minister of Finance will be happy to provide a particular update to this House. I also would like to say, Mr. Speaker, that given the rapidly evolving situation, there was advice which came out of the Public Health Emergency Response Team regarding policy matters where there may be a need to extend the session or to pass some emergency legislation to give the government additional powers in which to deal with matters which may arise. So that is something that is under active consideration and will be discussed in the Cabinet on Tuesday.
Thank you. Supplementary? No supplementary?
No supplementary.
The next member whose name is on the list is that of MP Commission. We've got 2 minutes left on the clock. MP, if you'd like to exercise your question.
Thank you, Mr. Speaker. Mr. Speaker, I have a non-coronavirus related question. I heard someone say that we still, even in this time, must be able to chew gum and walk at the same time. The question is, what has been the impact, Premier, of STEAM education implementation in public schools under the PLP government?
Premier?
Thank you very much, Mr. Speaker. Mr. Speaker, I thank the honourable member for his question, and I think what is particularly important is that we recognize not only of the progress of which has been made on education matters in accordance with the Progressive Labour Party's platform, but also on the announcements of which were made by the honourable minister in this House, of which I'm sure there'll be a number of questions regarding education reform, which is a particularly important topic. What I can say, Mr. Speaker, is that project-based learning is reaching all students, and this builds confidence and self-esteem. Students who are exposed to this education are more articulate, and this causes natural leaders to emerge. Students who do not usually shine academically are beginning to stand out due to the hands-on approach. The STEAM curriculum causes students to think differently and creates more in-depth understanding, and resources are readily available, and the program has an EIE curriculum, is currently in 10 Resources are readily available, and the program has EIE curriculum, which is currently available in 10 primary schools as per the Department of Education's plan to phase out the program.
Premier, time has expired. It's now 11:08, and this will begin at 10:38. So the 30 minutes have expired,